Hello, everyone. Good afternoon once again. Another month is with us. And since we celebrated the festive season, we've enjoyed. We are here to talk about Caesarean section or C section, or what are the indications that a woman will go through Caesarean section.
Caesarean section or C-section or Caesarean birth is the surgical delivery of a baby through a cut made in a mother's abdomen and uterus. Like I said before, Caesarean section again or C-section or Caesarean birth is the surgical delivery of a baby through a cut or incision made in the mother's abdomen and uterus. Healthcare providers use it when they believe it's safe for the mother and baby or both. The incision can be made in the skin either at the lower abdomen of the mother or vertical. So it's either horizontal, a thin line under the abdomen, or vertical, that is upwards from the navel all the way down. So somebody will ask, why cesarean section? Is a means of saving both baby and mother. We know that the normal way is, somebody will say, oh, the normal way is by having vaginal birth, but it's not every woman who can have vaginal birth. It's not every woman. So, like I said before from the beginning of this program, we are educating everybody watching us, men, women, pregnant women, non-pregnant women, so that we will be equipped. Whether you are pregnant now or you are about to be pregnant in future, or you are a spouse and your wife is pregnant and the doctor suggests cesarean birth, you shouldn't run away, you shouldn't go anywhere, you should stay and listen. The reasons why the doctor has suggested cesarean birth. Now, on my screen now is a woman who is pregnant. You see that around the baby is lying in a protective sac. So we have the placenta, we have the umbilical cord, we have the uterus, we have the amniotic sac, we have the amniotic fluid, then there's the cervix and there's the vagina. So the placenta is where baby gets all its nourishment from. So blood supply, oxygen, minerals, water is from the placenta. The umbilical cord is the tunnel that all these nutrients pass through for the baby to get. The uterus is what carries the baby, and it can expand all the way. When it expands, the stomach also expands. The rectum will flatten and the uterus too will flatten. So the stomach can expand all the way to where the diaphragm is. Then we have the amniotic sac. So the amniotic sac is what the baby lies in and feel comfortable. So somebody will say that is baby's room and bed combined together. Then we have the fluid. So the amniotic fluid is the one that nourishes the baby's skin. That gives baby the normal temperature in mother's abdomen, so that baby can thrive, baby can live, baby can survive for the next 9 to 10 months or 10 and a half months before baby comes out. Then we have the cervix. The cervix is where the baby passes through, or where we check the dilatation. is where there will be a sign. Either there will be the show, either the water will break. You see it will break from there, then it will pass through the vaginal canal. So before you get to the cervix, you need to pass through the vaginal canal before you can get to the cervix. Now, this is how our baby looks like. Now, there are indications which shows that a mother needs cesarean birth. So it's not just as we see, but there are things that will come that will show that baby automatically or mother needs to come out through cesarean sections. Now, we have previous cesarean birth. So you have delivered your first child or your second child or your third child through cesarean birth. With your first child, definitely they will try you for labor for 6 hours. We are expecting that labor should progress. When labor progresses, then you can go vaginal birth. But in the next 6 hours, if labor is not progressing, you are still at 1 cm. Then you go back to the theater, which means there's a problem. So any woman who has had previous cesarean birth before is an indication you can go back to the theater again. Then we have fetal distress. Fetal distress is the baby is in utero, baby is not breathing well, so the FH or the fetal heart is just fluctuating. It's fluctuating. Then also, because we want to see, so we make sure that if baby wants to leave, the best way of saving the baby when baby is in distress is through cesarean section. Then we have breech presentation. So breech presentation is when we have types of breech presentation. So when baby is coming with the buttocks, and we have frank breech. So frank breech, baby has curved him or herself, legs are up, hands are holding the legs, the head is also anti-flex towards the abdomen. When it's like that and baby is coming out, it's very, very dangerous. You need an expert, so that expertise to help you or help the mother. So most of breech presentation from day 1 all the way to 42 weeks is recommended that the baby is delivered through cesarean section. Then we have field induction. Field induction is when they give the woman, in quote, forced labor. We are expecting the woman to progress. They give the first dosage, second dosage, third, fourth. They are not going to continue. They'll send the mother to theater and take the baby out. Then we have severe preeclampsia or eclampsia. So preeclampsia, you are not yet in eclampsia. So BP switch cannot be controlled. Mothers who have previous history also of eclampsia or preeclampsia and they are pregnant again and the occurrence happens again. So BP switch cannot be controlled. That will send you into a state of fitting, convulsing, and blur vision. You lose your orientation as a woman. We put all these things into consideration. So those are some of the signs and symptoms of eclampsia and preeclampsia. We send the mother to theater to save both mother and baby. So when BP cannot be controlled after 28 weeks or from after 28 weeks and it cannot be controlled, you are being managed. It gets to a time they can't even control it anymore because any medication they give you, it doesn't work for you. So they will look at the risk factors, who can be saved first, And the priority is the mother, because definitely you can get pregnant again and give birth. So the main priority is to save the mother. Baby survives, we thank God for that, but the main priority is to saving the mother. There are a lot of chances that both baby and mother are being saved. That is when mother is referred promptly. Mother doesn't go back and sit in the house and say all is okay, I'll wait for my own time and go. But immediately prompt referral is done and they send you to see the doctor. Doctor gives you the reasons why they need to send you to theater outright. You don't give excuses and say, I want to go and do this, I want to go and do that, I want to go and do this. Because by the time you come, every minute counts. By the time you come, what needs to be saved about 5 minutes ago, it cannot be saved anymore. So let's heed to it. When they refer us and they send us to the hospital or where you are, they send you to see a doctor because they tell you they have to save the baby outright. So they'll start managing you, start preparing you for the surgery. Please allow them to do that, because that one too is an emergency. Then we have failure to progress in labor. So poor maternal effort. Mother has dilated up to 10 cm. We have 10 cm and mother is not pushing. We expect mother to push. She's not pushing. When we do that, we are suffocating baby one, and mother is actually also saying she's tired. She can't push anymore. Those ones we also recommend. Then failure to progress in labor. So we are expecting every 1 hour mother should progress by 1 cm. Every 1 hour mother should progress. You came in, the V was 1 cm. The next 4 hours we went to check you again, it's 1 cm. Another 4 hours we go back and check you, still 1 cm. No, you are not progressing in labor, which means there's a problem somewhere. So we need to make sure prompt decision is being taken to save you and the baby. Then also upon maternal request, so you, the mother, since the one you got pregnant, you went to your doctor. Doctor, I don't want to push. All I want to do is you to do cesarean section for me and take my baby out. That one too is there. Then we have a mother with medical history. So medical history like high BP is medical history. We have a mother who is a sickle cell patient. We have a mother who is asthmatic. All these conditions are medical history. You don't hide it from your midwife when you go for antenatal, because we take history. Based on that, we expect you to tell us the truth, and from that we'll take it up from there. Then multiple gestation. You are pregnant with more than 2 children, definitely 2 or more children. The doctor will advise you, will counsel you, will educate you on cesarean birth, because we call something maternal exhaustion. You get tired, you push the first baby out, now it will be left with the second and third and fourth. Then it will become an issue that you can't push. So definitely advice will be given, education will be given, counsel will be done for you to know the essence of going for the cesarean birth. Then a precious pregnancy. So a precious baby, for instance, the mother is above 45 years or 50, they are above 45. That's the first child. And the mother wants to have the baby. She knows that she herself, she can't push the baby out. She opts because one, the baby is precious to her. That's the first child. And any medical doctor or medical practitioner will tell you, or surgeon will tell you that this baby is precious. That's your first child. It's best you go in for cesarean section. Then we have the placenta problems, the placenta abruptio. Then we have the placenta previa, that is grade 4, grade 3 and grade 4 placenta previa. All those ones are part. Then we have cord prolapse also. So cord prolapse, that is when the cord is coming before the baby. It's not advisable for you to push because spasm can occur on the cord. We can lose the baby. So it's best cesarean section is done to save both. No, baby is not well in position to come. And those children, if even the maneuver is done and still baby is lying at that particular position, definitely we'll go for cesarean birth. Then obstructed labor is also part. So there's something, like I said, when the first stage is delaying, you know that there's obstruction somewhere. That's why dilatation is not taking place. Mother gets to 4 cm, she's not dilating anymore. Then there's something holding it. That is what we call obstructed labor. Mother starts from 1 cm. The next 4 hours, she's still at 1 cm. Mother starts from 1 cm, she dilates nicely up to 7 cm. Now she's not dilating anymore. After 4 hours, we are expecting, even before the 4 hours, mother should be full or should be around 9 cm. She's still at the 7 cm. We wait for another 3 hours. Then we have antepartum hemorrhage. So whilst you are pregnant, you start bleeding, or whilst you are almost at term, you start bleeding. You bleed whilst it's not yet time for baby to come out. You are bleeding profusely, and we need to save your life. So at the end of the day, we will recommend that cesarean birth is done for you. Then also we are saying that uterine rupture, it can be the uterus can rupture whilst you are pregnant. When the contractions are so severe, it cannot be controlled. All medications are given to you, it still cannot be controlled. And when the uterus rupture, which indirectly the uterus, or in a layman's language, will say the uterus have burst, bleeding will start. And when you start bleeding internally, it's not a good sign. It's telling us that mother is dying. What do we need to do? We need to save mother. So at the end of the day, what we do is go in, take the uterus out so that we can save both baby and mother. So that is uterine rupture. Now I'll take it all over again. So we have placenta previa, 2 or more cesarean sections before. So malpresentation can be transverse or oblique lie. Then we have multiple pregnancies. So the first baby can either be cephalic or breech, or breech, or the third baby can also be part breech. So all these babies automatically, definitely we have to go for cesarean birth. Then also we have fetal distress, like I said. So fetal distress, when baby is not able to breathe properly or the heart rate is very bad. We have non-progress in labor. Then we also have failed induction. Then severe intrauterine growth reduction. So baby is not small for date. Baby is so small. Then we have antepartum hemorrhage. We have breech presentation. We have medical conditions. We have also short stature people. So those whose shoes are below 36, if your shoe size is below 36, you are small stature. Even when we look in our antenatal card, you see there's under the history taken, There are those at risk. They've indicated it there. On your screen, you can see we've indicated it. So anyone who falls in that category, you use a red pen to circle, so that at the end of the day, when we start educating the woman from antenatal if she falls in that category. Before even a doctor sees her, the midwife starts educating her, start counseling her. All the needed education that needs to be given will be given to her. And always we even like that the spouse will be there, so that when we are giving the education, it covers both of them. So we always tell the woman, your next visit, please come with your husband, because we want to have a discussion with you both. Then we have the oligohydramnios, we have the polyhydramnios, we have babies who are big. So the big abdomen is there. Then babies who weigh more than 5 kilograms. If baby weighs more than 4.5 kilogram, 5 kilogram, 5.5, 6 kilogram. We have babies like that. Then we have mothers also who have pregnancy-induced diabetes and pregnancy-induced hypertension, which I've already spoken about that. So now we are going to have our Caesarean section. Then also one last thing, if we use instruments for delivery, for instance, forceps or vacuum delivery, if those ones also fail, definitely we'll go to the theater to take the baby out. So when there is failed trial of forceps or vacuum delivery, definitely those ones will be there. Now let's go to our Caesarean section, our procedure now. So we have planned Caesarean section and we have unplanned, or that is emergency Caesarean section. So the planned ones are the ones the mother will request, that is precious baby, multiple gestation, breech presentation from day 1 all the way to 40 or 42 weeks, malpresentation. So baby is either coming with the shoulder or the waist region or the neck region. All those are part of planned Caesarean section. If the twins are even Siamese twins, it's also part of Caesarean section. So the unplanned ones are the emergency ones. So the emergency ones are called prolapse, uterine rupture, eclampsia or preeclampsia, prolonged first stage of labor, then abnormal uterine contractions, the placenta previa, which is being diagnosed in labor, so either stage 3 or stage 4. Those ones are emergencies. So those ones, we don't wait at all. We don't wait at all. So the emergency Caesarean delivery, when the operation is performed due to unforeseen complications arising either during pregnancy or labor without waste of time following the decision. So immediately the decision is made, we go in. But the plan one, there will be lots of education and counseling done from the day 1. You see your midwife, you see your doctor, you see your midwife, you see your obstetrician and gynecologist. You continue. But the unplanned ones or the emergency, those ones we rush in to save you, the baby and the mother. And the Caesarean section, the team comprises of the anesthetist who has been trained for that. We also have the surgeon who has been trained for that. We have the scrub nurse and we have the midwife also, scrub nurse or scrub midwife. Then we also have another midwife who will take care of the baby. Then we have the floating nurse or midwife also. in the theater who will be helping the surgeon, the scrub nurse, to be picking things which is not in their reach. And we should also remember that cesarean section is a surgical procedure. So everything about it is sterile. Everything about it is sterile. So before we have a cesarean section, what we do is you'll be admitted. So a planned cesarean section, you'll be admitted a day before or hours before. They'll have the surgery done for you. So because counseling is already ongoing, will continue on you, the pregnant woman, the midwife will come and help you to have your vaginal care by shaving you where the need is, by making sure that psychologically, physically, spiritually you are prepared. Then also she will pass the catheter. After passing the catheter, definitely, because a relative needs to be present to sign your consent form as a witness, whilst you yourself also sign. All your medications for the cesarean section will be brought to you. So they will take everything from the pharmacy, all that you need. The doctor will write everything, and it will be brought from the pharmacy to your bedside. If you have any allergies, please make sure you tell your doctor, so they will put that into place. It will be indicated on your folder so that the doctor is aware, the anesthetist is aware, the scrub nurse is aware, the floating nurse is aware. So at the end of the day, they wouldn't give you something which is contrary to. Then, after all this preparation, the anesthetist will come in also, introduce himself to you, let you know what will be done for you, and prepare you also. Then your doctor will also be there. They'll have a nice conversation with you, explain the procedure, so that you be ready. You know what is going to happen. On this note, I'd like to say hello to Brad Jacob of Tema Polyclinic, and Dr. Ado of Trinity, and Dr. Otu. They are surgeons. They are not God, but they know their job. They know their job. They know their job very, 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 very well. I'd like to say hello. All mothers who have gone through your hands are saying thank you, thank you, thank you. Then let's continue with our procedure. So because you've been prepared the day before, you'll be told the time that they'll be ushering you to the theater. On this note, it's recommended that you take light fluids. Some will tell you to abstain from food from this time to this time, because they'll send you to theater and have the procedure done for you. So on that day, definitely your anesthetist will come again and say hello to you. Your doctor will definitely come again. The midwife who also prepared you will definitely come and say hello to you. So they have the history of you. Everything is ready before they will send you to the theater. So an incision, when they send you to the theater, the anesthetist will first give you the anesthesia at your back. So when he or she gives you the anesthesia, he's going to feel your back. Based on that, he'll count the vertebrae where he needs to give the anesthesia. Then he will tell you how the anesthesia will work, what you should expect before he will give you the anesthesia. When he's done, he will definitely put you down because you need to sit upright before they give you the anesthesia. When he's done giving you, he will help you to lie down quietly. You put your head down. He will tell you how to position yourself before the surgery can start. When it's done, now all the solutions, all the towels that will be used for you has been arranged nicely by the scrub nurse. So the doctor will drip, the scrub nurse will drip, the floating nurse will also dress up, the midwife will dress, the anesthetist will also dress. They all dress because it's a sterile procedure before the incision will be done. So first, before the incision will be done, they will clean the place thoroughly. Where the incision will be done, they have solutions that they have to use to clean the place thoroughly. So when the place is being cleaned thoroughly, before the incision can be done. So incision can be done either vertical or horizontal. So after draping you and cleaning you, then we'll go to the procedure. So whilst having the procedure, it's only from your waistline all the way to your leg that is numb. But you hear everybody, you see your environment, anything that the anesthetist will ask you, definitely you can answer because you are not asleep. You are not asleep at all. And the incision will be done on the abdomen, then the fat tissues, then it will go all the way to where the uterus is. Then we'll cut the peritoneum before we cut the uterus. Then baby will be taken out. Whilst baby is being taken out, suction will be done. So because baby is lying in a sack, and at the end of the day, the water doesn't need to splash all over the theater. With suction will be done. While suction is being done, cleaning is also being done, so that the whole place will be sterile for baby to be delivered. Now, when baby is delivered, injection will be given so that placenta also can come out. But when your baby comes out and baby is being delivered, they will show baby to you for you to know the sex, either a boy or a girl, before the midwife will take the baby, clean the baby up, still in the theater room, dress the baby, weigh the baby, check the height of the baby, check the head circumference, give the baby vitamin K, then also come back again and show your baby to you. There are some places they will even put the baby on the mother where the breast is and tell the mother to hold on to the baby, especially when the mother is comfortable, when she can't wait to have her baby in her arms. So there are places the mother will say, please, when you move my baby, please, I would like to hold my baby. Give my baby a kiss. If the mother is strong enough, definitely they'll give your baby to you to have a feel of your baby. So at the end of the day, we are saying that cesarean birth, the priority is to save mother and baby, to make sure that there's a happy home, and at the end of the day, husband is happy, mother is happy, and baby is also happy to get a new family. There is what we call the golden hour after Caesarean section. That golden hour, we'll talk about that one. It's very, very important for mother and baby. Then, after baby is shown to mother and baby, it's time to expel placenta and do the closure. So, placenta and blood clots are being expelled. Uterus is taken care of. Uterus is sent back to where it's coming from. Then, the closure will be done. When closure is done at the end of the day, baby, mother, the team, how mother responds, everybody is happy. Mother is sent to the recovery ward with her baby. So at the recovery ward, we are saying that mother is sent to the recovery ward. At the recovery ward, the medications that mother needs to take, they'll give her, monitoring her vital signs, that is the temperature, the pulse, respiration, and the blood pressure. Also paying attention to the baby. So nowadays, some mothers, by 6 to 8 hours, they are up. But like I said, the golden hour after Caesarean section, that is the first 60 minutes after birth, is known as the golden hour, when bonding between mother and baby is maximized. Research shows that breastfeeding and bonding are improved when there is skin-to-skin contact. So when there is skin-to-skin contact, there's bonding. Baby is able to get mother's warmth. Breastfeeding is initiated. Baby gets its first immunity. That is the colostrum from the breast milk. Baby is able to pass meconium and pass it well. Baby is able to pass urine. Baby is active because there's that bonding between baby and mother. And that skin-to-skin contact also between baby and mother. So between 6 to 12 hours, definitely mother will definitely be up. And through that, we are saying that between 12 to 24 hours, mother can start sitting up, because that is what we call early ambulation. Nowadays, the medications they give, some even by 6 hours they are up, they try to sit. Between the 8th hour, they try to stand. It's called early ambulation. And like I said, the 60 minutes, that's the golden hour. Mother will have that bond, will breastfeed with, and also have that skin-to-skin contact with the baby. And we know the importance. That is, baby is able to pass meconium, baby is able to pass urine, then baby gets its first immunity. Between 6 to 8 hours, mother can start taking light meals, like the light soup, the agidi, soft porridge. All those ones are light and more fluids. Then within 18 to 24 hours, we still encourage the early ambulation. So that's one, you can be walking around, cleaning your baby, changing the diaper of the baby, putting your baby back, cleaning your baby is lying, you can also get up. Make sure that you change your pad, because the lochia will be flowing. And when lochia is flowing, definitely we need to monitor. So the midwife will come to you, will look at how the lochia is flowing. That lochia is the blood that flows after you deliver. So that will know if it's normal lochia or there's more to it. Then if help needs to be given to you, we'll rush in and do the needful to save you and save the home at large. Then also, by 18 to 24 hours, definitely catheter will be removed. The doctor will definitely come and see you. So that we encourage you to sit on the toilet gradually. Between 2 to 5 days, we are expecting you to go back home. Now, go back home. The site of the incision, after day 1, day 2, the doctor will come and inspect. We're expecting the wound to heal nicely because it's a surgical procedure. The first dressing was done at the theater. When they open it, another dressing will be done before you go home. Now, when we get home, we are expecting that there are things we shouldn't do when we get home. The first day, we shouldn't lift heavy things. We can lift light things. We can still change diapers for our babies. We can still move by going up and down. We can still sit. And we can still continue to take our oral medication. At this juncture, I'll say to our viewers, let's bring our questions at the comment section and let's answer our questions, because at the end of the day, there are lots of questions that needs to be answered. Our oral medications, some are for 5 days, some are for 7 days, some are even more than 7 days. It depends on how the mother and how the surgery went. Then also, we shouldn't forget, whilst at antenatal, we are expected to donate 2 pints of blood because there's emergency. When you go to theater and you are bleeding, it's the blood that they will fall on, that they will transfuse to save your life. And somebody will ask, and they didn't even use the blood on me. But don't forget, it can be used on somebody else to save somebody's life. Maybe that person will need more than 2 pints of blood. That person may need 3 or 4 or even 5. Because in the theater, nobody knows, only God knows. But the team, their main priority is to save both mother and baby in the theater. So we shouldn't forget to donate our blood. We shouldn't forget to donate our blood. Then also, within 6 weeks, we can, by 6 weeks, which is by when baby is ready to take his or her first injection, mother can start exercising, because you are fit enough, you are strong enough to exercise. And by 6 weeks, you have started laying new eggs. That means you can equally get pregnant again. So we are saying that 6 weeks also, if you are not ready, please, let's have family planning done, because it's also very, very important. Research has shown that when you deliver by Caesarean birth, after 2 years before you can have another child, to prevent so many complications, you, the mother, needs to be strong enough to carry the baby, to prevent uterine rupture also. So the advice is you wait after 2 years before you can get pregnant again. If it happens along the line before 2 years and you realize you are pregnant, please don't sit in the house. Rush to the hospital. Go and report yourself to your midwife and the doctor. Let them know, so that precautionary measures will be put into place to save both you and the baby. So family planning is our option for the next 2 years, because we have to be healthy, we have to be strong, we have to be ready for the next baby. Then on my screen, you see postpartum exercise. So there are some postpartum exercise that you can do after 6 weeks. So we have the 4-point kneeling. You can look at that. We also have the leg slides. We also have the knee raised. We also have the leg extension. Then we have the knee heel touches. These 1, 2, 3, 4, 5 exercises. You can do it every 30 minutes in the morning. Every 30 minutes in the morning. Every 30 minutes in the morning. Because the exercise, one, is very good. It also helps the pelvic floor. It helps the vagina. And it also helps the bladder. And it helps in the uterus to contract more, so that you can have yourself back the way you were before you got pregnant. Then another school of thought will ask, how long does it take for cesarean section, the site, to heal internally? So internally is between, give yourself 6 to 8 weeks. At least by 8 weeks, internally it should heal. Then externally, by 12 weeks, you should be ready. So that is after 12 weeks. If you want to tie the belly, we'll recommend after 12 weeks. You can tie your belly after 12 weeks, because that's when you are ready to tie. So internally is 6 to 8 weeks. By 8 weeks, internally the wound has healed. So these exercises, you do it lightly. The more you do it, the more healing also takes place. But we shouldn't put stress on ourselves, because when you put stress on ourselves, even that place, the site, you start feeling pain. And when you start feeling pain, it's not a good thing to experience. So we are saying that we can continue with our 4-star diet, because we need to get adequate nutrition for ourselves, so that we can produce quality and quantity breast milk. Quality and quantity breast milk, so that baby can have enough and baby will grow. So when baby comes out, before 6 weeks, baby is supposed to get the BCG and the polio O. The polio O and the BCG, at least in the next 2 weeks when baby comes out, you should get these 2 vaccinations for the baby. Then for the first vaccination, that is the 6 weeks, is there. So we need the polio 1, we need a rotavirus, we need a pneumococcal, we need all those first shots for the first 6 weeks. Then another schedule is 10 weeks, then another one 14 weeks. This cycle is very, very important for the baby, because we want to prevent childhood illnesses, and these illnesses are preventable. That's why the immunization schedule is there for us to follow. We should also bear in mind that when CS is recommended or you have been advised, just always remember, it's to save mother and baby. It's to make sure that there's a happy home, there's a happy father, and there is a happy baby. We are also saying that if decision is made, we shouldn't say we are coming. No. At that particular moment, your life needs to be saved. You waste 1 minute, 2 minutes, 3 minutes, 4 minutes, 5 minutes. That minute can be used to save you. We shouldn't forget that. We shouldn't forget that.
On behalf of my crew, on behalf of myself, I say we thank you so much. We love you. And we encourage that at the end of the day, you know that Caesarean is a lifesaver. Thank you.